lethargy and pituitary necrosis, this can also cause decreased lactation. A very stormy post-operative period and sore nipples, occipitals, and again another thing, nowadays lot of young girls are undergoing breast surgeries, especially for reduction, mammoplasty, etc. That can reduce the amount of milk which is excreted. Then radiotherapy for breast carcinoma, many young ladies actually are having a higher incidence of breast carcinoma. So in those cases, they definitely have a decreased milk supply, where we can ask for complementary feeds. In those cases where it's a myth, we can ask the mother to take enough fluids and high calorie, frequent feed, and for how long and long. Because the mother will feed for 5 minutes and then she feels exhausted. She says, no, I'm not having enough milk. But you must convince her, no, you have to feed her for at least 10 to 15 minutes. It is not enough, because first she gets the fore milk, then she will get the hind milk, and both the milks are very much important for the baby. So you cannot give up by just feeding her for 5 minutes. Use proper breastfeeding techniques, monitor the weight gain, and in spite of that, if there is not enough milk, then give her galactalogs. There are proved galactalogs and galactagogues like metoclopramide, domperidone, 10 mg TDS. It can be given for 10 to 15 days till enough milk is produced. Or we are using certain Ayurvedic preparations with very good results like Lactaid. It comes in the name of Lactaid, available in the market, which actually has fenugreek like methi, etc., which definitely increases the amount of milk. These are the comfortable positions in which the mother should breastfeed her baby. She is comfortable, the baby is comfortable, and the feed is adequate. These are some of the wrong positions, as you can see. Mother lying down, there is a tension between the mother and the child, and this is what happens, which I am going to tell you when in cesarean section. The mother is suffering from a lot of pain. She is not being able to get up for the first 48 to 72 hours, and she starts feeding the baby in that position. And then she says that, doctor, I do not have enough milk, or I have a sore nipple, and things like that. And then they immediately start on tinned milk, and the problem starts there. So I think cesarean mothers need a lot of more motivation, because they have a lot of pain, they are sedated, they have fluids, they have catheter, and they have a lot of psychological stress, because they feel that I am not a full mother. Because they feel only by a normal vaginal delivery you are a successful mother. If you have undergone cesarean, you are a failure. Most of them feel that way, and then they feel that I am handicapped. I have a scar on my abdomen at such a young age. So all these things are a lot of stress to the mother and the family's psychological stress, etc. Then twin delivery. Twin delivery, the mother has to manage two babies. When she has one baby, she cannot sleep at night. Then imagine twin deliveries with two babies demanding for feeds. Simultaneously, it becomes a real stress to the mother. Then how many of them are privileged to have a bedroom exclusively from themselves? I think most of them don't. They have to feed in front of them, father-in-law, brother-in-law, anyone. So they feed for lesser time, they feed in awkward positions, and they create all the problems. And the job pressures. We are lucky to get 6 months maternity leave and childcare leave, etc. But in private firms, you either work or you don't get paid. So they are under a lot of pressure. So these are the things which have to be tackled not only by doctors and medical staff. I think NGOs and other bodies can come up and help in these situations. These are some of the practices which are incompatible with lactation. I'm not going to go into details. Contraindications of breastfeeding. Mothers, children of course with lactose deficiency will have diarrhea, etc., which is intolerance to breast milk. But mothers with HIV, hepatitis B, cytomegalovirus, and active tuberculosis, there is a relative contraindication, especially with HIV in our country. We have to weigh the pros and cons, and then we have to advise accordingly. But I think it's better to avoid in these 4 situations breastfeeding. Then mothers on chemotherapy, radioactive isotopes, anticoagulants, because breast milk actually concentrates these drugs over a prolonged period. These are the recommendations for promoting successful breastfeeding. This has been told to you over again. This baby-friendly hospital initiative, it has got 10 parameters, which actually when I started my post-graduation in 1992, that I forgot to mention initially, year of World Breastfeeding Week, which we are celebrating. And it was in 1992 it was initiated. When in IPGMER, when we were doing post-graduation, Dr. Amitav Shen was there as a pediatrics head, and he had actually, we became a baby-friendly hospital in 1992, SSKF, and that time this was put up in the labor room, in the antenatal ward, and also in the pediatrics ward. So these 10 steps we have to follow, and it repeatedly comes in the postgraduate exams. What is the 10 steps of the baby-friendly hospital initiative, and they are very important to be remembered. I'm not going to go into the details, the repetition of what we have actually said over this lecture. I have the world's healthiest fast food. I like this caption because we are in the age of fast food, and if all our society and mothers realize that this is the fast food which actually going to develop a healthy nation, then why not? Thank you very much.
Next speaker.